My guest on this week's podcast has an amazing story of resilience. At one point, her gut health was so bad that she weighed 83 pounds, and the food that she was ingesting was coming out the other end completely undigested. And on top of that, she was dealing with breast implant illness at the same time. So her story is one that I think you are going to be amazed by, and I think we're going to learn a lot by as well. All right, well, let's get to my guest. Her name is Bethany Cameron, otherwise known as @LilSipper on Instagram. She almost died from a severe combination of gut issues, such as gastroparesis, candida, parasites, yeast overgrowth, and colitis, and she overcame them through a natural and holistic approach without medication. Well, she is now a cookbook author. She's the host of the popular podcast Digest This, and she's a creator of the well-known Instagram @LilSipper, where she helps others overcome their own gut issues and shines a light on the food industry and how it's making us sick. Well, Bethany also has her own line of gut healthy supplements called Bethany's Pantry for those needing gut health support and or sensitive to most things on the market today. Well, her story is definitely a shocking and inspiring one where she was really almost at death, and using the power of food and actually avoiding certain foods helped bring her health all the way back to quote unquote normal. And she's doing great now. And on top of that, she tells us her story about breast implant illness, which may have contributed to all of this as well. So let's get started with my interview with Bethany Cameron, otherwise known as Lil Sipper. Well, thank you so much for joining me, Bethany.
Well, thank you so much, Tony, for having me. I'm so excited to just dive in and all of the things today.
So let's start by introducing you. You have over 1 million followers on Instagram under the name Lil Sipper. You share a lot of gut healthy recipes, very simple recipes, some of them with very limited ingredients, which is great. You also have a super popular podcast. Let's just, as a way to introduce you, tell my audience what you're up to today.
Yeah, so as you mentioned, I do a lot of healthy cooking. I have a lot of recipes on my blog and on my Instagram. And I got into this because I had a very long history of gut issues. And so now that I am back to a healthier life and have recovered, most of what I do now is basically just helping others navigate through their gut issues. And I make recipes designed for those with IBS and gut related issues.
Now, some of your gut related issues started way back when, at a time when you actually had breast implants. So we're going to talk a bit about the whole gut health story that you have, which is absolutely, I think, shocking for a lot of people, but I think people can learn a lot from it. But me being a plastic surgeon, this being a beauty podcast, let's start actually the discussion with your journey with breast implant illness. So my understanding is that you decided to get breast implants around the time you were having some marital issues. Can you talk a little bit about that?
Yeah, I know. So I had breast implants. I have since explanted. But I got married when I was very young, around 20 years old. And then my husband actually left me about 2, 3 weeks after we got married.
Oh, wow.
So of course I was in a state of like, oh my gosh, like kind of wanted a new me per se after all of that tragedy. And so I wanted to get breast implants to kind of boost my self-esteem, and I did. And I didn't have any issues at the beginning. Everything went great. The surgery, no complications there. But because of that, and I do believe along with the stress of just the divorce and all that, a lot of things started to go downhill. And breast implant illness wasn't even a thing. I've never heard of it before. And I really never dived into it until many years after I had got the implants. But leading up to me researching breast implant illness, I was getting really sick. I was having tons of gut issues, everything from yeast overgrowth to parasites to gastroparesis, which is paralysis of the stomach. It's basically when your stomach muscles actually stop working and you can't digest food. I mean, you name it, I had it. And I got down to a very low weight. I mean, I'm 5'7", and I got down to like 82 pounds. And I was skin and bones. I could, I mean, I looked like a walking skeleton and I could not digest anything. And things were literally coming out the same way they were coming in, just whole food, undigested. And so even me trying to eat, yeah, I wasn't absorbing anything. And so a lot of gut issues. And I can go into, what I did to try and heal. But
So you were previously healthy. You get married at a young age. You get a divorce pretty quickly. I know you said you separated. I'm assuming then you divorced after that. And then you underwent breast augmentation. How long after you had the implants put in did you start having gut health issues?
I mean, it led up to it. I wasn't like, I would say maybe 2 to 3 years after I got the implants. And of course, with any kind of gut health issue or any issue, it doesn't like automatically just go from 0 to 100. I started just getting a little bit of pain here and there, and it kind of escalated more and more.
So during the time you started having these gut health issues, did you talk with your physician about it? Do you have a family doc or an internist?
I mean, I went to different places. I went to the top places, Cedars-Sinai in Beverly Hills. I went to all of the doctors, and they just wanted to prescribe medication. Breast implants was not even, on their radar as far as that being a complication. They really just looked at my diet. All they did was just give me medication. Nothing about what I was eating, or I mean, maybe they said, take out dairy and gluten or something. That wasn't really into like the nitty-gritty.
As you mentioned, you got down to 83 pounds. And my understanding at one point, you were actually in a coma.
I was. That was after I healed my gut.
Oh, that was.
So
Okay.
it was, yeah, it was after that. I went into a coma a year. It's interesting you mentioned that though, because this was back in 2008 when I went into a coma. And this was about a week before I had scheduled to get my breast implants removed. And unrelated, and because I had went into the coma, obviously I didn't get them removed then. I postponed my surgery to get the explant a year later. Otherwise, I would have gotten them sooner.
What got you so sick that you ended up in a coma then?
Get this, I had low sodium levels. I mean, my low sodium levels, they were off the charts low. And they said they've never seen anyone have these low levels before. And I went into a state of shock and went into a coma for 3 days. Since then, I salt my food like nobody's business.
All right, so let's go back. You're starting to get these symptoms. You've seen a number of doctors. You've gone to Cedars-Sinai. For those people who don't know, I mean, and I lived myself in LA for a year. I mean, that is really one of the top medical institutions in the LA area. They really can't find a solution for you. How did you end up finding ways to heal your gut? Did you see a doctor, a health coach, a naturopath? Did you do this yourself? Can you tell us about that journey then to healing for you?
Yeah, so I went obviously from doctor to doctor, and no doctor really addressed anything. Like I said, they just wanted to give me medication. And I had one doctor at one point just turn me away and said, "I'm sorry, I can't help you. Like, go somewhere else." And so I was really at a loss. So I went the whole holistic route, sought out a doctor. First of all, I sought out a holistic doctor and went through his protocol online. So he was not in my same state. And he actually, I feel like, made me worse. So he put me on about like 30 different supplements a day. And it was a little bit weird because it was like he said, only buy my supplements, only get my brand. And like that kind of threw me off a little bit. And I sent him photos of me and I was like, look at me. I am a walking skeleton. This is not okay. And he's like, just don't worry. Just keep like following my regimen. He wasn't concerned. And like to me, I was like, look, dude, check me out. I am not well. Anyways, long story short, I diverted from him and connected with a family holistic doctor who literally just saved my life. He did not put me on any kind of pill or medication or supplement. Everything that I did to heal was through food, and not only the food that I ate, but how I ate it. For example, I've said this many times, instead of eating meat, I pureed my meat into almost like a paste, like a pate. And I had to go on a puree diet for about 9 months. And I want to emphasize it was not a liquid diet, but a puree diet. So basically putting foods, solid foods in the blender, pureeing it into a applesauce consistency. And I had to treat my gut as a newborn baby, as you would when you're introducing foods to a baby. It's all pureed down, and that's what I had to do.
So you added the pureed beef, I'm assuming, and then bone broth. Was that a big part of this as well, as far as the gut healing journey?
Yes, bone broth was huge. I made my own bone broth from whole chickens. And also, I want to point out it's not all what you are consuming and taking in, but a lot of it has to do with what you're not consuming and what you're cutting out, because that can just be as detrimental.
Hmm. Did he give you some type of a diagnosis, or did your other doctors give you a name for what you were going through? I know we could say that you weren't absorbing your food or digesting your food appropriately, but was there an actual diagnosis given?
Yeah, so they did a bunch of colonoscopies, they did endoscopies, they did that time test where, kind of they watch how long the food goes down and gets digested with all the blue dyes and all that. And they did diagnose me with gastroparesis, they diagnosed me with gastritis, they diagnosed me with possibly Crohn's. It wasn't like, for sure. I diagnosed myself with parasites because I was doing enemas in my bathroom and I saw one come out. Literally, it was about like this long. I still have a photo of it on my phone, and it was disgusting
Like a
and
tapeworm
like
or
a
a
tapeworm. I
roundworm?
mean, I don't even know what it was, but it
Oh my
freaked me
gosh.
out. Yeah. And so I knew I had parasites, and then I saw other smaller ones come out too. So I had yeast overgrowth, so it was a multitude of things.
I know you said, okay, you had the gastroparesis, you had colitis, you said that you saw the parasites, that was kind of self-diagnosed. How did they diagnose the candida, the yeast overgrowth? And how did that present for you?
So you can find that with an endoscopy or colonoscopy, depending on where the yeast is. I would see the yeast in the toilet. Like the overgrowth was so bad where it was just everywhere. The yeast was just coming out.
How did that look? What did that look like?
I don't know. Like I said, I mean, we're friends here, right? All of your
Yeah, yeah.
listeners.
Oh, yeah, yeah, yeah.
We could talk about whatever. We could talk about poop, but I
Yeah,
mean,
yeah,
I
it's
sent
okay.
photos to my holistic doctor and I was like, what the heck
Wow.
is this? And he's like, yeah, like it's just overgrowth of yeast, like out of control.
Let's talk about some of the foods then you added to help with your gut. We've talked about pureeing your meat, like your beef. You talked about bone broth. What are some of the other foods that really seem to help you heal your gut? And then we'll talk about some of the foods that you then decided to go away from because they were making your gut health worse.
Yeah, well, one of the foods that was a staple and still is till this day is plain cultured yogurt. And I know yogurt and dairy in general gets a lot of backlash regarding digestion and gut health, but I do want to say that yogurt is completely different than dairy, because I know it is technically dairy, but it is now the chemical has changed and it's cultured. And so now that it's cultured, it's been fermented, it has a different structure and you can digest it so much easier. And because it was also, basically pureed, it was a lot easier to digest. It was very high in protein. And I mixed that with cooked and cooled white rice, because when you cook and cool any kind of starch, it actually reduces the carb content, because I had to be very careful with carbs because of the yeast at the time. And it acts as a resistant starch, which is actually food for your good bacteria. So mixing the cooked and cooled white rice with yogurt, kind of like I would say rice pudding, really. It was actually delicious. That really helps a lot. And I really had to keep things plain, not a lot of spices or sauces, and eat things. I want to tell you too, like it's not just what you eat, it's not just how you prepare it, but it's also how often you eat it and when. I know snacking can disrupt your digestion if you snack all day, right? For the normal person. However, for me, again, I had to treat my body as a newborn baby, and babies eat all day long. They eat little bits, but all day long. And so that's what I had to do. I couldn't have three rounded meals a day, I had to eat every 2 hours, just a little bit to jumpstart my system. And so that's what I had to do.
And so, real quick, so you mentioned earlier the rice turning into resistant starch. So the idea is you're really giving prebiotics and probiotics because you're giving the yogurt as well. Do you prefer Greek yogurt over traditional yogurt, one or the other?
I do prefer Greek yogurt only because it's higher in protein and it's lower in sugar. When a typical yogurt, it still has a lot of sugar just from the whey and things like that. But it's not to say that it's, I never touch it, but I just prefer Greek.
Okay. And then what are your thoughts on collagen and gelatin? Sounds like that may have been part of your healing journey too.
For sure. I did, like I said, I wasn't taking any supplements at the beginning, but then I started to incorporate collagen powder, gelatin powder. I still consume it till this day, every single day. And that really helped, especially the gelatin. And I was getting creative in the kitchen and I thought, gee, I'm so limited. Let's just make stuff that nobody else is making. And that really does help because the collagen and gelatin both heal and seal your gut lining. And so when your gut is really disrupted and the walls, they're protecting your gut from bad things coming in and also good things coming out.
So really you're talking about healing. I mean, these are a lot of things that people talk about when they're talking about healing leaky gut. And I'm assuming that was also a component of what you were dealing with.
Yes, indeed.
So let's talk now about some of the foods that you eliminated. I mean, did your doctor decide? I tell you that there were certain things that maybe created this situation for you, or was it the accumulation of different foods you were eating? I mean, I know there are things that you got off of, but did you ever find a reason why this happened to you? Whereas it doesn't happen to, it's never happened to me and so many other people.
Yeah, I mean, I have my speculations for sure. And from what my holistic doctor had told me, there was a number of factors that all happened at once. I mean, like I said, I had all these different things, the parasites, the yeast, the gastroparesis, not to mention the stress, the divorce, my breast implants, which I'm sure we can get into too. And so I had a lot of different factors happening at once. However, going back to right after I got the implants, right, I was still pretty young, feeling good. I also got into working out and got into the gym. And at this time, I was like early 20s, didn't know a dang thing about nutrition. And so in my mind, I got into the health and quote health and fitness world. I would go to the gym every single day. I'd work out for an hour and a half every day. That's a lot, too much. And so I was putting a lot of stress on my body and I was eating crap, Tony. Like I thought I was doing my body good, right? But I was being marketed all this stuff and believing it. I was eating crappy protein bars, crappy protein powder, packaged meals that were quote healthy for you, right? The better for you packaged meals, all these really, really bad processed foods that were marketed to the fitness industry as protein this, protein that, low carb this, sugar free that. And yeah, I bought it. I fell into it. And I believe the accumulation of that over time really set my body up for disaster. And then my eyes were opened working with my holistic doctor of like, I have been literally poisoning myself. And once I cut all of these foods out that I think a lot of people, maybe not your listeners, I know they're very well educated, but a lot of people still don't look at the ingredients that are in quote healthy foods like natural flavors and gums and stevia. All of these things are still thought of as a healthy ingredient.
Of all the foods that you have eliminated from your diet, was there one or two that you feel made the biggest difference? And we'll cover a bunch of them here in the next few minutes. But just to start off with, was there one that you felt, oh my gosh, I stopped doing this and 2 weeks later, or I stopped eating this and 2 weeks later, I feel so much better?
Yeah, well, there's a lot, but I will say some of the top offenders that a lot of people still consume every single day. One is stevia, and I can get into that. Another is gums, whether that be xanthan gum, guar gum, locust bean gum, whatever. And man, I would say citric acid, honestly, is a big one. I know a lot of people don't think about citric acid, and we can go into that, but there's a lot of different additives and preservatives that people just don't think of as causing any kind of harm to them.
Do you feel that these, I mean, so xanthan gum, the gums are in obviously a lot of ultra processed foods. I think a lot of people look at that and they just kind of look over it because they assume it's a very small part of that food. Those really do make that big of a difference.
They do. And I also think too, because technically these are natural things. Locust bean gums comes from nature. All these things do come from nature, but when they're taken out of context and then put into something that is not supposed to have a gum, then that's where the issue lies. Like, think of eating scrambled eggs and then adding gums to the scrambled eggs. Well, the scrambled eggs aren't supposed to have these gums. You're supposed to eat them as nature intended. So when you're altering things and manipulating and adding even added fiber to things, people think that's great. Well, that food's not supposed to have fiber. It's supposed to be as it is. So then you're really messing with how nature intended you to eat it.
Stevia is a favorite amongst a lot of holistic health practitioners, nutritionists. I have not heard a lot of people say bad things about stevia other than the fact that it is super sweet. And there is, I think, a lot of science to show that these super sweet, ultra sweet sweeteners cause our taste buds to become desensitized to what is normally sweet in nature and real food. Do you have, other than that fact, which we know is true with any of these artificial sweeteners, is there anything else about stevia that you really have an issue with? Because you're one of the first people I've heard of come after stevia.
Oh, wow. Well, first of all, Tony, yeah, you bring up a great point, is that these are altering our taste buds and making us desensitized to the flavor of natural things. So we tend to just crave sweeter things, and a strawberry isn't sweet anymore because we're so used to these overly sweet things sweetened with stevia. But beyond that, stevia goes through a 42-step process to make it from a green leaf to that white powder that you add to your coffee or to your tea. Let that sink in. 42 steps going from a green leaf to a white powder. And you have to think, well, wait a minute. How did this white powder become white powder? It's bleached. It goes through so many different chemical processes, solvents, hexane, all these things. And not a lot of people just really think about that. So that whole thing, it's not stevia anymore. It is completely altered and made in a lab now. If you were to take the green stevia leaf that you were growing in your backyard, it would not have the same effect. It would not taste the same. It's not as sweet. If you were to just grind it up, dry it, it would be a green powder, right? So there is definitely a chemical change there. Also, there are many studies showing that stevia it disrupts the gut microbiome. So it actually causes gut disruption and can alter that, along with being a contraceptive. And there's studies to show that too, that stevia is known to be a contraceptive, which many people are having fertility issues these days. And even long back in the day, a lot of people would use stevia purposely if they did not want to get pregnant. So there's many different factors here. Oh, yeah.
Oh, I'm gonna have to look into that one. Yeah, that's
Definitely.
a new one to me. All right, so let's talk a bit about dairy. So you mentioned earlier that you are a fan of certain dairy, limited, basically yogurt, but not a fan of other types of dairy for your health. I'll tell you, I am in agreement in general. Now, I will have some dairy. I'm lactose intolerant, so I can't drink, let's say, a glass of milk. Not that I would want to. I am typically a fan of more of the dairy substitutes. I will have cheese every so often. I can't tolerate yogurt for the most part. Tell me what your thoughts are with dairy, because right now there are a lot of nutritionists, there are natural medicine people who are big fans of dairy all of a sudden. I feel like it's just been going the last year or two where people are talking about raw milk. Cheese once isn't a big deal. A lot of people are big fans of whey protein. Tell me your thoughts on dairy as a gut health expert.
Well, yeah, I think you are right that everyone does react different to dairy. I want to put that out there. But as I mentioned, regular, plain, unsweetened yogurt was a huge part of my healing. Now, I think that a lot of people know if you are consuming sweetened yogurt or yogurt with fruit at the bottom and like all those little things, I know that that's pretty clear. You should stay away from that. Always go for the plain. Now, beyond that, I know, like you mentioned, raw milk is a huge movement. And I think there are tons of benefits for raw milk. I personally don't consume raw milk just because I know that I may have a bad reaction to it. If you are immune compromised, I don't think it's a good thing to dabble into that, but just because you know your immune system is just not as strong as maybe the next person. But if you are pretty strong, young individual with a good immune system, I don't think raw milk is a bad thing. I think it has tons of amazing benefits. But I love goat milk. And so I do like to drink goat milk every once in a while. And that does really good with my digestion. Interesting thing about goat milk or goat milk yogurt, anything goat or sheep, the fat molecules are smaller, like technically speaking. So they're smaller than cow's milk. So you can digest and absorb the nutrients in goats or sheep's milk versus cow's milk, where the fat molecules are larger. So that's an interesting point. So also, there's, if people are not aware, there's A1 and A2 milk. And so you do want to look for the A2 protein, and that's a lot easier to digest too. So there's a lot of different things when you're talking about dairy. That's just not like one size fits all. There's some cheeses, soft cheeses versus hard cheeses. Some people can't do hard, but they can do soft, or vice versa. And so I'm not completely like ruling out dairy, but I do think that you really kind of have to play around with it yourself to see what fits your structure, your body.
Any concern about the hormones and antibiotics in dairy products?
For sure. Yeah. I mean, if you can find grass fed and organic, all the better. Now, I know everyone's on a budget, so I know that's not always an option. And I think, when you're trying to eat healthy, there's always that factor too. And so whole foods, even if it's not organic, is still better than processed. But now, Tony, I don't know if you've realized this goes with meat too. When you see grass fed meat, now it doesn't necessarily mean they're on the pasture. They could be in a farm, just in this little box and being fed grass. It's ridiculous. So now I'm just like,
Well, I mean, industrial farming is going to, find ways to get around, I think, a lot of this stuff, unfortunately. I did see a video just the other day of exactly what you're describing to me. I think it was Dave Asprey that actually put it out there. And it was these cows in this, basically industrial barn, and just this huge amounts of grass, this machine basically just throwing it at them. I was like, what is this? I've never seen that before, but I mean, it makes sense when you're looking at it from a business perspective of big food, that's something that they would try to take advantage of. How about gluten? What are your thoughts on gluten? And I assume, are you gluten-free?
I am gluten free. I will have some authentic sourdough here and there. And I think a lot of people can tolerate sourdough, making sure, if the wheat is organic, it's an organic flour. I think that's huge because it's one of the glyphosate is one of the top offenders, any health issue really, and in wheat especially. And so other than that, I really don't consume gluten, maybe some lavash here and there, things that are just minimally processed. But I think that especially in America, gluten and wheat is just not the same as it is in Europe and other countries where it's manufactured differently. They're not spraying glyphosate. And so I think gluten, definitely taking that out, can be a huge game changer for your gut health. Not only that, but your skin health, your beauty, all of that, your brain, your cognitive way of just thinking about everything can really be a game changer.
Have you yourself experienced going overseas and having gluten in other countries and that affecting you differently?
I haven't been to Europe yet. It's on my bucket list. But I mean, I always hear stories about people saying, I went there and I had all the pastries and bread and I was fine.
So your doctor helped to heal your gut just by choosing the right foods that are soothing to your gut, by slowing down, I think, how much you're eating at a time, by taking smaller amounts. You talked about pureeing your food. You've gotten rid of things like gluten and dairy and these gums and artificial sweeteners and all of that. At any time, did adding supplements become a part of your healing journey? And if not, are you on supplements now?
Well, I do take supplements now. I am a big pro supplement gal. And I did start to implement them as my holistic doctor was like, okay, yeah, you can take this and that and the other. And they were definitely part of my healing journey. I think for anyone with gut issues, a supplement that is either in powder or liquid form can be better. Not to say that the pills are not, but they could be a little bit harder to absorb and digest. So, always keeping that in mind. I do take pills and supplements now too, but I'm a huge pro supplement gal just because now we're just not getting the nutrients we are from a whole food diet just because of the soil's depleted and all of the things. So,
did your doctor then incorporate supplements into your healing journey, or is that something that once you felt like your gut was pretty well healed that you started adding in yourself?
It was actually a little bit of both. He really got me on valerian root, which is great not only for sleep, but for relaxing the muscles in your gut because sometimes they can really tense up. And CBD, he got me on. I before him, I had never heard of CBD. This was like back in 2016 or something where it like wasn't even on the map yet. Yeah, CBD was a big one.
And what are you taking now? What's your supplement regimen today?
Oh
Or
my
is it a
goodness.
lot?
We need like another podcast for this one,
Oh,
but I do take quite a few.
do you? Okay. Well, can you just quick list them off, or is it going to literally take?
I mean, I alternate them too. So I think a lot of people, when they think, oh, I take a supplement, I don't take these every day. I may take, like 3 times a week this one and like twice a week the other one, because I don't think you need to take a supplement every day. You can overdo it. But yeah, I do take different brands like probiotics. I take valerian root, Shilajit. I think right before we started talking, I was like, oh, I have Shilajit in my mouth. Is it making my mouth black? So that's been a new one, which I'm loving. Helps with fertility, helps with brain and brain health and things like that. So,
But you mentioned it tastes like tar, though, not so great tasting.
it tastes like feet. It is, I mean, not that I've ever tasted feet before, but yeah, it
Is
tastes
it going to discolor your teeth, though, too?
depending on the type. So there's like pills that you could put under your tongue, or there's a resin where it's kind of like a paste that will turn your entire mouth black.
Yeah, you got to wonder if that would also, end up staining your teeth with time, too. But how often do you take Shilajit?
I try and take it once a day, like a little under the tongue pill. Yeah. And have you ever heard of methylene blue?
Yeah, oh yeah.
Okay.
Yeah.
That's another one that kind of stains. What's your view on that?
It's interesting because I've used methylene blue ever since I was a medical student in the operating room. We use it as a dye for various procedures. So you can use it, let's say, if a woman's got breast cancer and you're trying to localize a tumor, you can use that to help localize where a tumor is. For us, we use methylene blue, sometimes very simple. There are some surgeons I worked with where instead of using an operating room marker, let's say to mark skin that you're going to take off on a facelift or an incision, on a breast, they would use methylene blue to do that. Sometimes we would use it to tattoo the skin. So for example, when I did otoplasty, when we would pin back ears and we would want to, let's say, mark the skin on both sides of the cartilage of the ear, on the inside and the outside, then you can dip a needle in methylene blue and then put it through the skin and it literally will tattoo both sides. So it's used in those manners. And then when I hear that there are natural health experts who are using methylene blue because of its antioxidant healthy properties, I've never used it that way. I've never, I think in traditional medicine, heard of it used that way, but I am more and more hearing people saying that that's been beneficial for their health. What do you use it for? Tell us a little bit about it.
Yeah, well, it's a tincture. That's mostly how you take it. You just put it in your mouth under the tongue, and it really does stain your entire mouth blue. I mean, it comes off, but it's great for fertility. It's great for immune function. A huge thing is UTIs. And so I know a lot of women, they take that if they have a UTI or just to prevent it if they're prone to them. So that's a big one.
Yeah, I've seen methylene blue where we have it in a little cup and then somebody accidentally spills it and it's on the floor and it stains the floor like forever. So it's funny because, these things you put in your mouth, me being a plastic surgeon, I'm always wondering, when I don't drink much coffee anymore. I did for a while. I went to my dentist after drinking coffee. Probably every other day I would drink coffee, and I went to my dentist and she said, you must be drinking a lot of coffee because your teeth are getting really stained. And for me, I see people who are my age, I'm 51, and they don't really take great care of their teeth. And you could see that they don't. And for me, that's a big thing. Is I had dental surgery a long time ago. I wore braces for probably 10 years. And it's like, if I do anything to ruin my teeth, I'm going to be so upset because my parents paid a lot of money for these chompers. All right, well, let's shift gears a little bit. We mentioned earlier that breast implant illness was a part of your story, and we've talked about how your gut health has been impacted in general. I think we've made some passing references. Let's go back then to when you had your breast implants. You started getting sick. How did you start thinking about your implants being a cause or maybe a contributor to some of your health issues?
Yeah, well, I love this question because everything works together. So I cannot say that my breast implants caused my IBS, right? Like directly. However, I do think that they opened the door to allowing all of these infections to play into my body because basically I believe that it weakened my immune system in general because it's literally a foreign object in my body. And then my body was like, no, this is not supposed to be in here. And it's being like autoimmune basically and trying to be, it's like on a hyper alert. And so I think that it opened the door and allowed my body to just have a weak immune system in general so that the things that I was consuming just made it 10 times worse, if that makes sense.
I see that with some of my patients. Did you, before deciding to have your implants removed, did you talk with your natural doctor about that and about whether making some of these changes in your gut health may prevent you from needing your implants taken out or anything like that?
Yeah, I definitely discussed it with him. And of course, I did my own research too, which at the time, this was, yeah, I don't know, back like again, so many years ago that breast implant illness wasn't really talked about. I mean, if you Google it now, there's tons of things that pop up, right? But back then, I really had to go into forums. I had to really dig deep into this, and it wasn't really well known or exposed, nor were a lot of surgeons admitting to this, which I know that you don't do breast implants any, be just because of the effects.
I do, but I take a lot of them out as well. I think that
You
it
do,
comes down
okay.
to being, yeah, it comes down to being, I think, an educated patient. And I think for a long time, and even still, there are a lot of plastic surgeons who gaslight their patients and say, well, we know it's not your implants. The studies show that it's not, but what studies are you referring to? It's a very controversial topic amongst plastic surgeons. I think that there are some black and whites, but there are also a lot of gray areas with it. And we definitely need more science to help support, I think, the movement, realizing that these implants can make people sick. So you end up going back to your original surgeon?
I did. Yeah. So she was great. She was in Beverly Hills and I approached her and I said, "Look, there was nothing wrong with what you did, but I was concerned." And she definitely heard me out and agreed. And she said, "Look, I'm actually seeing a lot of people getting their implants removed and going to a smaller size. It was a huge movement back in 2019, which is when I got my explant done." So she was definitely on board. And I think that if anyone is considering an explant and they have breast implants now, if the surgeon you went to get your implants in, if they are open to removing them, and they have a good repertoire for that, I think it's a great option. And here's why. And you may disagree with me, and I'd love your take on this, but if you go to the same surgeon that put them in to remove them, they know your body, they have your history. And so, for example, in my case, my surgeon, she's like, "I already know your body and we know what happened last time. And I'm, fully prepared. I know what I put in." She had that record of everything. And so it was a lot easier process. And I do also want to say, if anyone is considering to get their implants removed, to make sure you get the capsule removal as well.
I agree with you in that the surgeon who does your operation originally is going to know your body the best. And if you trust that surgeon, by all means, it makes the most sense to go back to that surgeon. Another point that you didn't make that I think should be made too is that it also may financially benefit you as well. If you go to a brand new surgeon, they don't know you, they have never treated you, then you're going to potentially pay more than if you go to a surgeon who you've already paid for the first operation, especially if it hasn't been that long. And now you're finding that the implants aren't doing you well. You hope that the surgeon would have compassion for you and say, hey, look, we're not going to charge you as if you were a new patient here. And so I think that's another point to be made there. And regarding the capsule, did she do a full capsulectomy? Did they talk about en bloc? What was your discussion with your doctor regarding the capsule?
Yeah, I definitely made sure that they took everything out, and which you may be able to describe this better to your listeners, but they basically had to scrape away from I don't want to say the bone, but just from the ribs. And a lot of surgeons, they'll leave the capsule there, which is still a foreign object in your body, and it's still lingering in there. So maybe you can explain a little bit better?
Yeah. So this is interesting where the science is ever evolving. Even in the last, honestly, like 2 months, there's new science that come out because there has been a belief for a long time that all the capsule needs to come out if somebody's going to get better if they've got breast implant illness. And for many years, that's what I have always done with my patients. I still do that because my patients ask me to do it. But there are a couple of new studies. One was literally just published a month or two ago. Small studies, but with statistical significance, where they actually take patients with BII, breast implant illness, and they compare people who have just the implant taken out with no capsule removed to people who had complete capsulectomy, and then people had what's called en bloc, where it's all removed with the implant all intact, and found very similar, statistically basically the same amounts of improvement in their BII symptoms. Now, these studies are not big. You're talking less than 100 patients, but the outcomes were statistically significant, showing no difference between these. I don't think that I wouldn't take that study and tell my patients who come in, I've got BII, can you do a capsulectomy? I wouldn't say, no, we're not going to do it because of this one study. But I think it's important that we are looking at that and find that out, because the capsulectomy, which, like I said, I've been doing on my patients for years, we do it because we don't know. And it makes sense that, okay, whatever is maybe in the implant may have leached into the surrounding capsule, the scar tissue around it. If that's the case, possibly the patient won't get better if you don't remove it. But we never had any science to actually show that is necessary or compare people who had it versus who didn't. And so that information is getting out there. And I think that's really important so that we can make science-driven decisions for our patients. So I'm still doing it the way I have in the past, but I'm definitely watching the research, because the fact really, Bethany, is that when you do a capsulectomy, especially ones where you're trying to remove every last little bit of capsule, that's more invasive. It's a harder recovery. It's a potential risk of a punctured lung. And so if it was the same amount of invasiveness, then hey, why not just do it? But when you're talking about, hey, let's do a longer operation, keep you under anesthesia longer, pump you full of these, narcotics and unnatural substances for an hour longer so that we can get rid of more of this. If there's no known benefit of it, then we're actually doing the patient a disservice. So it's evolving. It's evolving.
That's great research. You're bringing me back. I'm like, oh my gosh, I cannot believe I had all this done. One thing I do want to bring to light too is that I get asked a lot from my followers, like, hey, what did you do after you got them removed? Like, did you get skin lifted? Did you have, something else filled? And I think that's a lot of concern for people, like, oh, how are they going to look after?
So how did you feel? I mean, you're somebody who's very thin, you're lean. Patients like yourself are the ones that I worry about when I take implants out for BII, because typically their breast skin has been quite stretched out. And it's one thing if you already have a lot of breast tissue that you start with and the implant is removed and that skin will retract to an extent. And cosmetically, it's not as difficult, I think, it's not really a reconstruction, but you know what I mean by that. But somebody who's thin, who has low body fat percentage, a lot of times their breasts aren't that big, so there's not a lot of tissue there. And you can see a lot of unevenness and stretched out. How did you feel with all that? And did your doctor talk to you about that?
Yeah, so that was definitely a discussion we had prior to the surgery, because I was, of course, concerned, and everyone wants to feel their best and be confident in their body. And so I really followed my doctor's recommendation, and that was to leave them as is, not to remove any skin or not to fill them with anything because they would eventually, I don't want to say even out, but they would, let me backtrack, because she did say she didn't recommend me doing anything after the fact, but she did warn me that they would not look the same, obviously. And I mean, I didn't really have much to start with. So, I mean, I was basically a flat, board. But yeah, my breasts did sag. And I remember the first time after the surgery, this was maybe about a week after the surgery, I saw myself in the mirror for the first time. Like before, I would change the dressing and just look down, but I actually looked in the mirror, straight on and saw myself and I cried. But the thing was, I was not sad. I mean, I was like, oh my gosh, this is me now. But at the same time, I was so happy I got them out that I knew like my health was more important to me than the way that I looked. And so I was still okay with it. And again, a week out from surgery, it's not how you're going to look, a year later.
How did your symptoms change once your implants came out?
It's funny you asked that because I actually documented everything on my Instagram during the time. And so I had a lot of followers tell me, and I didn't notice this, but I had a lot of followers tell me like my eyes were brighter, like 24 hours after, like the whites in your eyes looked better, like everything just looked like the haze was gone. So I didn't notice symptoms like improve immediately, and I think it did take a long time to see any changes. But one thing I will tell you is that I had them for almost 10 years. And I did notice that I could breathe deeper. Like I didn't know I could not breathe for like 9 years. And I was like, oh my gosh, this is how I can breathe. And I had a lot more range of motion in my arms. I was like, wow, I can stretch my arms all the way back now. And you don't know what you don't know. So forever, I just thought this is how you breathe. This is how I breathe. This is how I stretch. And it was a big eye opener.
Well, I'm glad that you've done so well since then. You've obviously been a beacon of hope for a lot of people who've got issues. I enjoy watching your Instagram because some of your recipes shock me and how simple they are and how you can take, let's say, 2 ingredients and make a chocolate cake or something like that I could not imagine it works, but it appears to do that. What of these really simple recipes that you have shared on Instagram that are gut healthy, that help heal your gut, what's probably your most popular one when you're talking about like a 2 or 3 ingredient recipe that you've put out there?
Oh man, I would say one that has been a tried and true recipe, and this goes back long, is my cookie dough bread. And there's absolutely no sugar, no grains, no gluten. It's paleo, it's keto, and all you need is cashew butter, eggs, and some baking soda. And that's it. And I mean, if you want to add chocolate chips, then boom, you've got sugar-free chocolate chips, or, I use 100%, so whatever.
Do you know it off the top of your head, how much of each that's in the mixture, or would we have to find it?
I do. Oh yeah, I know it like the back of my hand. Do you want the recipe?
Can you share it with us?
Okay, so you're going to add 1 cup of cashew butter, 4 whole eggs, a teaspoon of baking soda, and then I do like a splash of apple cider vinegar, but you don't have to. Mix it in a mixer, and then you're going to pour that in a bread loaf pan. You can add chocolate chips if you want, and then you're going to bake it in the oven for about 45 minutes.
At like 350?
At 350, yeah. And you'll watch it rise. And it's very deceiving because you're like, this is liquid. This does not look like a bread batter.
Yeah, exactly. There's no flour or anything.
Exactly. Just trust the process. And, 45 minutes later in the oven, you have almost 0 carb bread that is keto and is really not going to upset your gut.
That's great. I mean, I am not a chef. I am a surgeon, so I don't have tons of time. And your recipes astound me because I look at this, I go, I can make this and it will literally take me 5 minutes. And it looks so good afterwards. And it's so simple and it's so healthy. You got to follow Bethany on Instagram. She goes by the handle Lil Sipper, Lilsippr. She has the Digest This podcast, which I was a guest on, where she talks with holistic health-minded practitioners, gut health experts, all about how you can basically help heal your gut and have a healthy gut and overall improve your health. And you've got your line of supplements for gut health, Bethany's Pantry. You've partnered with NewZest. We're going to have all of these links in the podcast caption, so definitely take a peek at it. But start off by listening to her podcast and following her on Instagram because she's a great follow. At one point, I think 2 million people follow you on Instagram, and for a good reason because you put out some great content.
Oh, well, thank you so much, Tony, for having me. And it's always just a fun pleasure to just talk to you and pick your brain too.
Well, thank you so much for joining me today, Bethany. This was a lot of fun, and this was a lot of great information. I think you're going to really help a lot of people.
Thank you.
And if you've been enjoying this podcast, if you could leave a rating or review on iTunes or Spotify, it definitely helps me spread the word. Otherwise, I want to thank you, everybody, for watching, for listening. My name is Dr. Anthony Youn, and this is the Dr. Youn Show. As always, remember to eat real food, use clean skincare, and auto-juvenate before you operate.